hello to you all. My name is Oliver. I was one of the instructors for this lab this week. I myself used to be a former Capitol debater. I debated for their public forum travel team for 5 years. I just graduated high school a few months ago, and now I'm here. This is my first summer coaching for Capitol Debate, but this is my week number 7. And next to me on your screen is my co-instructor, Nicole.
Hi, I'm Nicole. I actually did a Capitol camp in high school. I didn't do as much as Oliver, but this is my second year with Capitol. I did the in-person camps last summer, which was so much fun. And, because of Corona, we had to move online, but I've had a great time with everyone so far. And I've had a great time teaching and working alongside Oliver.
All right. And we're about to get into telling you a little bit about Capitol Debate. But before we do that, I just want to say this week really has been wonderful. It is always really exciting for me as a coach now to be able to work with higher level debaters because there is just so much more that we can discuss. And it throws me back to the good old days when I was competing. And now it's really nice to be able to give back. And also, it's also very inspiring to see all of the potential in this group and how bright these kids are. And I know that a lot of them are going to have a lot of success on the circuit as long as they just keep working at it. And I'm excited to hear about how well they do this coming year. All right, let's get into those slides. Okay, so first and foremost, this goes for both parents and students. You can use either of these links to let us know how you felt about the week. So parentsurvey.capitoldebate.com or student survey. This feedback is very important so that we can continue to improve the program. So if you had any recommendations for this week or anything you liked, just please let us know here so that we can continue improving the program. All right, and today only, you can use a coupon code NEXTCLASS2020 to get $50 off the next camp. Now, our public forum course is the most advanced course that we have, but you can always sign up for a second week. Plenty of debaters do 2 weeks, and then in the second week that you'll do with us, you can work the other side of the resolution, so you'll have 2 cases ready to go before the fall. And again, there's the coupon code on the left side. Now, here are a number of other programs. Now, the more debate section probably doesn't apply really to these debaters because they are so advanced. However, if you are interested in these other programs, you should feel free to sign up for them. Legal communication, which I know is very similar to mock trial, and that also is something that can be quite competitive in high school. Business communication, interpersonal communication, and finally, STEM communication. All right, and questions. So you can always email the Capitol Debate office at team@capitoldebate.com, or that phone number down there will work as well. All right, 2021 Debate League. Now, given the state of things in the world, Capitol Debate is introducing a number of new programs, but all of these new programs are really rooted in things that they've been doing for a long time. So I myself was a part of the public forum travel team, and that was pretty much all done online. And all we did was just meet in person for tournaments. So the infrastructure is already there, but now it's just open for a wider variety of programs. So for this year, they're introducing this debate league. Registration is now open, and they're planning on having debate tournaments every month. They're going to have a new topic every month as well. So there's weekly practice and online resources. So, if your school is not really supporting your debate team, especially in this time, Capitol Debate is a good alternative, and you can save $100 now for the next couple weeks.
I'm also going to add in something here. Even if your child or student doesn't want to do this, like your public forum child, if you have siblings or something like that who are a bit younger, this is like a good opportunity for them, because I think we work with middle school students, so it's like a wider variety of opportunities.
All right, finally, keep in touch. Feel free to, I think Stan mentioned this. Well, I guess more than half of you are going to be keeping in touch with him pretty frequently anyway. But, let us know how you're doing. Our Capital Debate emails will always be active. You can always, if you have questions about programs, email the office. Hopefully, camps will be open next summer. If not, we'll probably be online again. So just feel free to stay in contact with us. And this is our lovely class, our group photo.
Okay, so here we have these certificates. These are just like a little way to honor everyone and their hard work this week. I'm pretty sure these are going to be forwarded to the parents. So first we have Amelie. Good job, Amelie. Lots of hard work this week. Amelie is actually our maverick this week. So that means that she, typically in public forum, there are partners and they kind of split the work. However, this week, Amelie is doing the entire debate on her own. So she wrote the case, wrote the blocks on her own, and is doing the work of two people. So really good job, Amelie. Okay, then we have Karam. Good job, Karam. Lots of good work this week. We've seen like massive improvement in you, so really, really good job. Can't wait to see what you do in the showcase. All right, Olivia, yay, good job, Olivia. You also really hard work this week. Everyone's done a really, really good job. But yeah, good job, Olivia. You are constantly asking questions and trying to get better, so good job. We have Anya. Yay, good job, Anya. Um, you've worked super hard and you've shown improvement in your case writing and just your technical debate skills. So, yay, good job. Okay, Akshita, that is Anya's partner. Yay, good job. Again, everyone's worked super hard this week. Akshita has improved it has improved this week and done just a good job. And I hope to see her succeed in the future, or at least hear about her success in the future. Good job, Asa. Yay. Asa has learned, I know Asa has learned a lot this week. So good job, Asa. He's been coming out of his bubble because he's done other kinds of debate. So good job, Asa, for adapting to public forum. Jake, yay. Jake did a really good job this week. He did really well and he won our little impact debate like mini tournament this week. So good job, Jake. You're a really hard worker. And I believe that is it.
Yeah,
Yes, that is the end.
okay. So, again, once again, congratulations to you all. I know I was really impressed. Sometimes I would check in on our little drive folder and I would see people working on their stuff at odd hours. And that's, it can be a sickness, but it really is how you get better. And it really is nice to see that kind of dedication, especially in the summer. Also, it's not even the real season. So congratulations to you all, and really good work on this week. So now at this time, we're going to have our showcase debates. And in the interest of time, we're not going to have full public forum rounds, but the speeches are going to be slightly abridged. So rebuttals would usually be a minute longer, as would summaries. But every speech is still there. We are cutting out Grand Crossfire, just does not usually tend to go well over the internet, but we will have everything else in the round. And the resolution today is that the US federal government should enact the Medicare for All bill of 2019. So this is a pretty interesting topic because it is very relevant. It's pretty political as well, which is pretty interesting. It's a pretty interesting decision from the NSDA to choose this kind of resolution. Now, our first debate is going to be between Amelie, who will be negating the resolution, and also Anya and Akshita, who will be affirming the resolution. All right, so you three can get started whenever you're ready.
Just a warning, there's a little bit of construction going on, so there might be some background noises.
It's quite all right.
Okay, my time starts now. We negate the resolve. The United States federal government should enact the Medicare for All Act of 2019. Contention 1, worsen quality of care. Warrant A, failure of single-payer healthcare systems. Example 1, Veterans Affairs. According to a 2019 report by Spradley, the Veterans Administration healthcare system is a socialized single-payer program funded by U.S. taxpayers with hospitals owned by the government and healthcare providers who are government employees. As said by a 2018 CNBC article by Irby, the VA is struggling to keep up as the need for veteran care continues to mount. Additionally, the VA has been plagued with scandals, as an article by an investigator, Bronstein, says. At least 40 U.S. veterans died waiting for appointments at the Phoenix Veterans Affairs healthcare system alone, many of whom were placed on a secret waiting list. This secret list was part of an elaborate scheme designed by Veteran Affairs managers in Phoenix who were trying to hide the 1,400 to 1,600 sick veterans who were forced to wait months to see a doctor, according to a recently retired top VA doctor and several high-level sources. In the and the federal government was unable to properly service veterans who are, according to Census Bureau, 7% of the population, or 18 million people. How could they possibly successfully provide healthcare for every resident of the United States? 328.2 million people. Example 2, Vermont single-payer system failure. Another example of a small-scale government-instituted healthcare failure system is Vermont's attempt at a socialized healthcare system. According to a 2017 Forbes article by Pearl MD, a best-selling author and Stanford professor, Vermont made a serious run at state-based single-payer system only to see it abandoned after only 3 years due to major cost increases and the need to dramatically raise taxes to fund the expense. Additionally, a 2019 Harvard Public Health issued that despite popular support from constituents, an already low rate of uninsured residents and some of the healthiest residents in the nation, Vermont was still unable to make the system function. Vermont has an extremely small population of 628,000 and is the second smallest state population-wise. Even an extremely small version of this type of system is destined to fail. Warrant B, prolonged wait times. According to a December 2019 article by Baruda, specialized physicians surveyed a report of median wait times of 20.9 weeks between referral from a general practitioner and a receipt of treatment in Canada. As said by Pedal MD, the two main reasons for longer wait times are lack of physicians and outdated communication tools. The outdated communication tools are a result of there not being enough government funding for hospitals to invest back into the system to update tools. This study by Fraser Institute, titled The Effect of Wait Times on Mortality in Canada, estimated that increases in wait times for medically necessary care in Canada have resulted in approximately 44,273 additional deaths among females alone. As the United States has a population that is 10 times larger than Canada, this could lead to around 440,000 deaths amongst females from increased waiting times alone. Warrant C, hospital cuts/closures. Under the Medicare for All Act, the hospitals could lose massive amounts of money, leading to disastrous effects. According to a 2019 article by Panoro, healthcare providers will be reimbursed at the rates used by Medicare today, which amounts to a reduction of up to 40% from what private insurance pay. Only by slashing payments can proponents promise to cover so many more people. To put this into perspective, a 2019 article by Daily quantifies 90% of hospitals would face cuts totaling $200 billion a year. This means that there's less money to reinvest back into the system to have more supplies, life-saving technologies, and physicians. Additionally, in 2019, an article by Goldstein stated that Medicare rates could place as many as 55% of rural hospitals, or 1,037 hospitals across 46 states, at high risk of closure. For rural hospitals that somehow manage to stay open, their communities will face an increased threat of worsened service, reduction of staff, and economic loss. This is specifically harmful, as according to statistics by Rural Home, 21% of Americans live in rural areas. By voting affirmative, you are effectively putting at risk 65 million people in America. Thus, I strongly negate. Okay, is everyone ready? Okay, my time begins now. We affirm resolved. The United States federal government should enact the Medicare for All Act of 2019. Our sole contention is mental health. The National Institute of Mental Health quantifies that as of 2017, 46.6 million American adults suffered from a mental illness. Meanwhile, a study by William Harrison with the Centers of Disease Control and Prevention found that less than half of the adults with a serious psychological distress received mental health treatment, and they were significantly less likely to have access to health insurance. However, under the Medicare for All Act, Section 201, comprehensive benefits states that enrolled individuals are provided mental health and substance abuse services, including inpatient care. Critically, the National Alliance on Mental Illness explains that a combination of therapy, social support, and medication has helped 70 to 90% of treated individuals with mental illness to lead more stable lives. Without these services, the consequences of untreated mental illness will continue. This has 3 impacts, which leads me to subpoint A. Mental illness causes suicide. Ibrahim 2020 explains that mental illness has become a global health issue with life-threatening consequences when going untreated. For example, the National Alliance on Mental Illness says that 90% of those who commit suicide had an underlying mental illness. Meanwhile, the American Foundation for Suicide Prevention estimates that there was 1.4 million suicide attempts in 2018. However, with the treatment that Medicare for All provides, tens of thousands of lives will be saved each year. Which leads me to subpoint B. Mental illness causes substance abuse. According to a 2016 report by the U.S. Surgeon General, nearly 21 million people in the United States have a substance abuse disorder, and 7.9 million had a substance use disorder and another mental illness. Mental illnesses harms one's quality of life, making living often arduous. Many turn to drugs as an escape and fall into the vicious cycle of abusing drugs. That's why the National Bureau of Economic Research, NBER, defines a definite connection between mental illness and the use of addictive substances. Recovery is uniquely difficult as only 10% of these individuals receive substance abuse treatment. This is a clear crisis as the CDC quantifies that 67,367 people died from drug overdose in 2018. This cycle is very difficult for people to escape from, and many either die from overdose or die from the effects of prolonged usage of drugs. With free Medicare for all, rehabilitation centers are covered, and millions of people would be able to access the help they need. Subpoint C. Mental health reduces crime. Incarceration rates are high among people with mental illnesses. In the late 2000s, according to a survey conducted by the Police Policy Initiative, nearly 1 million out of the 2.3 million adults incarcerated per year, which is almost one half, had a serious mental illness. This high rate could be reduced with the treatment under Medicare for All. Indeed, a study in Pinellas County, Florida jail found that not having outpatient mental health treatment was significantly associated with increased risk of misdemeanor arrests and days incarcerated. Crime has serious implications for individuals and their societies. Those incarcerated have not only lost their jobs, homes, families, and freedom, but can also fall into a cycle of crime due to either being pulled into gang activity or simply turning to illegal activities for money due to the black record on their records. According to the Catholic Charities Archdiocese, on average, 76.6% of released inmates will return to prison. With a severe lack of resources after being released, homelessness, joblessness, and a lack of family connections often set a newly released inmate up for reoffending. Felons become inapplicable for jobs because of a permanent black record and are forced to affiliate in drug, gang, trafficking, etc. related crimes to provide for their families. Catholic Charities expands that children losing one or more parents to incarceration can set a child up for poverty and detrimental mental health issues. This becomes a never-ending cycle that will not end unless we act upon it. How much longer do we want to see children, parents, and consequently society suffer? The best way to save all of these lives is through enacting Medicare for all. We therefore urge you to affirm. Thank you. Are you taking any prep time before Crossfire? Sorry. No. Are you?
No.
Okay, perfect. Since you're pro, you can ask the first question.
Okay. So you said that 44,000 people in Canada, and then you converted that to 440,000 in America. Well, how did you convert that?
Okay, well, basically you can just do basic inflation because there's 10 times more people in America than Canada.
Okay, well, doesn't that mean that the more people in the US would mean doctors comparatively?
Well, you'd actually think that. However, in terms of hospitals, there's only 4.33 times more hospitals in the United States than Canada. And additionally, in this type of Medicare healthcare system, what we are going to be seeing is the number of physicians decreasing because there's going to be less money to reinvest back into this type of system because of the rates Medicare is giving.
Okay, thank you.
Okay, so when you're talking about the mental health coverage, how would people who need treatment for mental health know what's even being offered to them?
Well, Medicare for All provides that inpatient treatment is included for free, and a lot of these people are 40%, as I stated. The only sole reason for them not getting help is because they're uninsured. So this 40% of people, once they have the insurance, would easily be able to get the help they need. There's the 90% of people that still do not have health care, that still do not get treatment, but their 40% may seem minuscule, but comparing it to the 90% of people who do not have it, this 40% of uninsured people would be easily able to get the help they need by rehabilitation and others.
Okay, you have another question?
Yes. How does MFA directly cause all wait times, and how related are they?
Okay, so the reason why these two are very much connected is because the reason behind these wait times are an increased amount of people and outdated communication tools and lack of physicians. And these are all pretty much interconnected because of the fact of the Medicare rates are less than the private insurance rates, so there's less money to reinvest into the system, which
Okay,
is going.
you stated that there would be more doctors since there's 10 times as many people as you stated. So don't you agree that there would be more doctors and the physicians would be able to help this wait time issue?
I never said that there was going to be more doctors under this type of system.
But you agree that there was 10 times as many people, meaning that there doctors comparatively, even if it's not 10 times, wouldn't you say that there would still be more doctors in America than Canada?
Well, because of inflation, of course, yes, there's going to be more doctors. However, we're going to still see this problem in this system.
Okay, you can ask a question.
Okay, so is there any actual specific proof of effectiveness of these Medicare treatments?
Well, they haven't had this opportunity for these people who have not had health care. So it's proven that there's 40%, as I said before, that they do not have, the sole reason for them not getting help is because they're uninsured. So this implies that these 40%, once they have the health care, would be able to get the help they need.
I have a question. So are you trying to imply that the sole reason why people are not seeking medical care is because of lack of because that they don't have offers?
I'm saying the sole reason of the 40% out of the 90% who do not. I'm not saying in total.
Okay.
10% of these people get treatment, 90% do not, and out of this 90%, 40% are not insured. That's what I'm trying to tell.
Okay. I think that's the end of.
Yeah, that's fine.
Okay. Okay, I'm gonna take some prep time. Starting now. Okay. I'm going to start. I'm going to start now. Okay, so to talk about my opponent's first contention, the wait times created by universal healthcare will actually preclude access to treatment for mental illness, even when patients may be covered. In the UK, Blanchard in 2019 finds that almost 300,000 patients who qualified for taking therapy last year spent at least a month on a hidden waiting list. Additionally, to respond to my opponent's statement on the suicide rate, according to CDC, people are more likely to die from suicide in rural communities than in urban. So I turn that argument on them. And according to eHealthMedicare.org, this care can be received in a general hospital or psychiatric hospital. So as a result, this is going to be dangerous because not only will suicidal people not have access, they're not going to be able to get this proper access. This deteriorated sub hospitals is going to be enough that if they were to end up attempting, there's not even going to be a resource, aka hospitals, needed to physically save their life at the last resort. Additionally, as stated in a 2017 speech by Delgado, more than 65% of rural Americans get their mental health care from primary health care provider, and the mental health crisis responder for most rural Americans in law enforcement is a law enforcement officer. So really turn another argument on them because Medicare for All will cause hospital closures and severely worsen mental worsen services, and this is going to hurt people who are already getting treatments to suffer worse or no access. As a result, we're going to see even more suicides as mental health services will become less accessible in rural areas. This act will do more harm than help for suicidal people in rural areas. And as a result, I outweigh in the scope because the impact is of worse quality of care is going to affect all mentally ill patients. And instead of their argument, which it only benefits a fraction of those patients without coverage, even if it's best case scenario. And for these reasons, and I just realized I had more time. And additionally, there are some issues with accessibility, as according to PBS.org, reasons individuals reported not seeking treatment included not knowing to where to go for treatment and not having transportation to a facility. To respond to their contention on substance abuse, at best, this impact is minuscule. Lack of coverage is one of the only many reasons for users to avoid treatment. Reid in 2014 quantifies that 63% of users in a survey cited other reasons to why they continue to use drugs. And additionally, universal health care will worsen the quality of care, which is especially important for treating addiction. Parks in 2016 explains that the primary healthcare physicians know their patients very well, and this is dangerous when patients begin to show signs of substance abuse. However, MFA actually decreases access to these physicians by creating doctor shortages to turn that argument on them. Additionally, to respond to the third contention, this is really showing on their part, they're really showing this, they're perpetuating the stigma that mental illnesses makes people dangerous, which discourages people from getting treatment in the first place, which has been chosen by a fact-check article by Kranz. Experts estimate that 1 in 4 people have treatable mental illnesses or emotional difficulties, but up to 75% of Americans and Europeans don't seek the help they need. A recent study in the psychological medicine shows that the stigmas associated with mental illnesses still is a major barrier in seeking treatment. And for these reasons, I negate.
Okay, Anya, prep time.
Yeah, sorry, hold on. My computer is being weird. I can't see anything. I'm gonna run a tiny bit of prep before.
Okay.
Get my timer out. Okay, starting now. That was 16 seconds. So my time should start now. First, on my opponent's argument of quality of care, we can actually turn this because the MFA will actually improve health outcomes through preventive care. According to Chua of the AMSA in 2008, the uninsured are unlikely to receive preventive care as they are 4 times less likely to have regular access when they're sick. As a result, 20% of the uninsured say their usual source of care is the emergency room. So we need to enact MFA in order to prevent that. Next, my opponent talked a lot about wait times and how that affected specifically the veteran survey. But what I'm telling you is that wait times are actually caused by funding gaps, not universal healthcare. Carol 12 explains that wait times in Canada are simply due to low cost of healthcare and thereby lower funding. In contrast, American Medicare currently has much lower wait times than those of Canada. Next, she talks about cutting funds for hospitals, but this doesn't apply because hospitals don't need nearly as much revenue as they take currently. According to Dr. Kayan Khan, as recently as 2000, Medicare level reimbursements were sufficient to cover hospital operating expenses. Since then, millions have been wasted on administration and expensive development projects. So through the MFA, we actually help hospitals enough so that they don't have to cut funds. Next, on her third contention of rural hospitals, she talks a lot about how they will close, but we can actually turn this because the MFA will increase funding for rural areas. According to callback 20 of The Guardian, Medicare for All bill is that includes funding to invest directly in areas without enough health coverage, including rural and low-income urban areas. Realize that hospitals are at risk for closure in both worlds. However, with the Medicare for All, Hospitals at risk for closure receive funding from the government and don't have to close. Also, on this point, note that she was bringing Canada's numbers of 44,000 deaths, and she was bringing that rate to 440,000 deaths in the US because our population is 10 times as big. But that doesn't apply because if we have more people, that also means we have more doctors. Also on doctors, she tried to say that people with mental health issues will suffer because of doctor shortages. However, you can turn this because through the MFA, it will remove administrative hurdles through private insurance, which means it reduces doctor burnout. Milton Packer in 2019 writes that most physicians have lost any meaningful sense of autonomy and are plagued by administrative chores. This is claiming that an extraordinary burnout rate of 30 to 50% and a frightening rate of suicide in doctors. This means that through MFA, there will actually be more doctors, which increases access to all of this healthcare. For all of these reasons, we outweigh on scope because we affect more people and we are helping more people get their healthcare through MFA. Therefore, you should vote pro.
Okay, are you ready for
Cross?
are you ready for cross? Yeah.
Yeah, are you? Are you gonna run prep or are you ready?
Oh no, I'm ready.
Okay. Sorry, let me get my timer. Okay. Time starts now. So when you say there will not be room in the system, do you mean there will not be enough doctors?
Can you rephrase your question, please?
You said there wouldn't be enough accessibility in the system. Do you mean there won't be enough doctors?
Okay, so what I mean is by there's not going to be enough accessibility in the system. First of all, if we think about it on a more larger scale, there's going to be a lot more people in the system. There's going to be a lot more people than ever before in the system because now both uninsured people and all residents, not just citizens. So as a result, this is going to create a clog up in the system. And on top of that, we will actually be seeing these doctor shortages because of as I've mentioned before, there's going to be less funding, which is going to result in less.
But I just said that doctor shortages won't be as prominent because there will be a burnout. MFA gets rid of the burnout rate, which means more and more doctors will come to work and continue to work.
Okay, but what I'm saying actually is that this is not the way it's going to end up working because of the fact there's going to be less money that hospitals are going to have to be able to hire doctors, and there's going to be less money that hospitals are going to be able to have.
My chart takes into account the money that's going away, but you can have a question.
Okay, so I have the same kind of question again. So when you guys really do mention the crime rate, there's going to be it's going to take a lot more time and resources in able to help children who have so much childhood trauma from parents being incarcerated. So how does the Medicare for All system really end up taking them into account?
Taking into account the amount of people who will be hurt from their parents going to jail?
The amount of time it's going to take, time and therapy it's going to need to take in order to help these specific types of children.
Well, I already made my point on doctor shortages, but also keep in mind that half of treatment for mental illness is medication, and it doesn't take that long to prescribe someone some type of medication. It's not all just therapy, but it will just provide awareness and accessibility. I mean, before you have any sort of block in the system, you need to be able to pay to get into the system, which is what Medicare for All will provide.
Okay, but as I kind of said in my rebuttal, it's not really going to have as much accessibility as a lot of people are saying. The reason why they don't even go to mental health care systems is because of the fact that they don't have the types of transportation. They don't really know where to go. So how does this work if it's not
pay for it? At least they have the chance, because that's non-unique, because that happens in the status quo. But if you enact Medicare for All, then at least they'll have the chance to get this treatment that they need in order to be saved.
Okay, and additionally, they're actually. Oh, can I ask a question?
Yeah, although wait 5 seconds.
Oh, okay, never mind.
Are you gonna take prep?
Yeah, I'm gonna run some prep. I currently took 15 seconds, so. Okay, so I'm going to frontline a little bit, and then I'm gonna go over my case and their case, and then if time permits, I'm gonna weigh. Okay. My time begins now. First, my opponent tries to talk about preventative care. However, there actually is preventative care in Canada, so that kind of hurts their argument. As according to ncbi.gov, in 2010, the Canadian Task Force on Preventative Healthcare was reconstituted through a funding agreement between the Public Health Agency of Canada and the Canadian Institute of Health Research. So we're going to be seeing the same type of lowered quality of care. Additionally, my opponent's trying to talk about how it's going to be there's going to be less people in the ER. However, a shortage in Canada, a shortage of emergency department physicians is often cited as the main cause of long hours spent waiting in the ER. A joint study led by KEAP, CEFP, and RCPSC found that Canada's healthcare system has a shortfall of 478 emergency physicians, a figure projected to rise to 1,071 by 2020. So this is going to lead to a backup in the ER as well. And going by what my opponent says, only people who need to go will go there. This is going to lead to this type of long wait time of everyone who really needs it. Additionally, I'd like to go. Additionally, I win on my rural argument, as I've previously mentioned, how suicide is going to be increased because of the hospital shortages. My opponent tries to tell you that hospitals aren't going to need as much, and MFA is going to fund more. However, this is simply not true. As I have previously mentioned to you, the hospitals are not going to be reimbursed as much, and this is going to cause 50% of all rural hospitals. This is going to cause 55% of all rural hospitals to close, which is going to cause 65 million people at risk. And for these reasons, you should negate.
Okay, I will run some prep. Let me get my timer. I'll start now. That's all I need. So that was 48 seconds. Okay. I'll do my case and then her case, and I'll frontline, and then if I have time, I'll add some weighing. Okay. My time begins. Sorry. My time begins now. So we are telling you that the National Institute of Mental Health found that 46.6 million Americans suffer from a mental illness. This is millions of people that suffer from this thing, and 40% do not have access to the facilities they need just because of uninsurance. So clearly we have a larger number of people that we're affecting. She says that 40,000 people in Canada are dying from this, but she does not take into account of the doctors that would be added to America, not just the people, because obviously there's going to be a growth in doctors here as there are people. Secondly, we are telling you that Centers for Disease Control and Prevention found this study, half of the adults with mental illness receive treatment. This is half of 46.6 million. So we are telling you that there are so many people that are affected by this, and only 70 to 90% of treated individuals live more stable lives. This accounts for the fact that when you have a stable life, you will not be committing crimes. And if we're telling you that 1 million out of the 2.3 million people who were incarcerated had a mental health issue. We are not saying that 1 million people would be reduced, but this is almost taking account that this is almost half of the amount of people incarcerated. Now, my opponent states that waiting time, that rural hospitals are not reimbursed, but what she doesn't take into account is that Medicare for All reimburses them money for rural hospitals exclusively, and they pay more attention into and put more funding into low-income and rural areas, meaning that hospital closures will not be as the 90% rate that she tells you is not true. So she fails on this argument. Second of all, she introduces wait times, but again, she doesn't take into account about the burnout rate of doctors. If in regular healthcare right now, there's a 30 to 50% burnout rate of doctors, meaning that they leave the hospitals because of their pay. But now what we're saying is that Medicare for All provides more funding, so less doctors will be burning out and leaving. So we outweigh on scope, obviously, because we have millions of people that are affected, 46.6 million people. And she has a estimation of 440,000 people that will be affected by this, but she still does not take into account that there would be more doctors. My time's up.
Okay, I'm gonna take the rest of my prep time. I have a minute left. Okay. My time begins now. So I would just like to say I win on scope because of the 65 million Americans that are going to be affected because of these hospital cuts. This is going to be a danger to so many rural Americans because this is going to consistently decrease the quality of care for them. And this goes into their suicide argument to where I win their argument as well. This is because in rural areas, people are more likely to die from suicide. And as 65% of these people with mental health issues are already getting help from these rural areas in hospitals, by the underfunding from Medicare of these type of hospitals and the ultimate closure and demise of the quality of care, this is going to ultimately take away their mental health, and this is going to end up leading to many more suicides. And we are going to just see this in a lot of other places as the funding is going to be decreased. And as I have mentioned before, hospitals are the main place where people get their mental health care from. And additionally, from what I've mentioned before, accessibility is another issue. A lot of these people don't go to mental health care places because of the fact that they can't get transportation. And as the MFA is not offering it, it's not accessible enough that everyone's going to be able to know where it is, and it's not going to be taken advantage of. Additionally, I'm just going to weigh a little bit, and in terms of scope, I win, and on impact because of this, as I mentioned before, the 65 million Americans that are going to be affected by all of these hospital cuts. Additionally, in terms of wait times, my opponents try to tell you is that there's not going to be any type of doctor shortage. This is just simply not true because Medicare for All is going to be funding less than private insurance, which is going to lead to doctors getting less money, which is going to lead to a higher burnout rate. So for these reasons, you must negate.
I'm going to run prep. That's starting now. That was 54 seconds. Okay, so I'm gonna frontline, then her case, and then my case. My time starts now. First, you have to focus on her block about doctor shortages. What her statistics don't take into account is the burnout. We tell you that 30 to 50%, there's a 30 to 50% burnout rate in doctor shortages right now, and with MFA, that'll all fix that, so that knocks out her block because she did not take this into account. Next, on her rural hospital argument, all of her statistics are going off the fact that rural hospitals will not receive reimbursements. What our statistics are telling you is that they don't need it because Medicare reimbursements are significant enough to keep the hospitals going. She's just saying they won't receive reimbursements, but that doesn't really matter because they already have all that they need to continue going. So she loses her numbers of 65 million and she doesn't take her impacts there. Rural hospitals will continue to stay open with MFA. Next, we give you numbers. We give you huge numbers. 46.6 million people in America are suffering from mental health, and the only way they can receive treatment is through Medicare for All. She's saying that they won't have accessibility, but that's non-unique. If they can't get there now, at least with Medicare for All, they'll have the option where they can pay for it, so that if they want to and if they receive the information, they can get to these treatments and they can get their treatment to fix whatever they need. Next, we also told you that 1 million of the 2.3 million incarcerated 1 year had a mental illness. In order to prevent this, we need to help them through mental treatment. Therefore, we outweigh on scope because we're helping 46.6 million through treatment, and then we're helping the 1 million who are incarcerated each year, in addition to all of their families and their communities that are being helped by keeping them out of jail. Therefore, we win on scope in all other arguments because we outweigh here, and her rural hospitals argument just isn't as significant as all our arguments. We need to enact Medicare for all in order to help people get the treatment they need to survive. Therefore, vote pro.
Okay, thank you, Akshita, Anya, and Amelie. That was a great debate. If you check your emails in a few minutes, I will send you the comments that I have from this round. Just a disclaimer: don't be discouraged. I only typed up the comments or suggestions I would have on how to change your speech. There was just not enough time for me to keep up and also write all the good things that I heard. But really, it was a good round. I saw you debaters incorporate a lot of the things that we talked about this week, and so that was really nice to see. So good round to you all, and once again, congrats on completing this week. Wish you the best of luck in the coming school year. All right, now our final debate today is between Jake and Asa, who are negating the resolution, and Olivia and Karam, who are affirming the resolution. And just for the spectators, something that's interesting about this group is that all four are from West Orange High School in Florida, and they are all students for Mr. Stan Banks, who is the lead instructor for the public forum program. So they all go to school together. They're all part of the same team, and they are extremely competitive with each other. And so I'm very excited to see the round. Our practice round was very exciting yesterday. So you all can take it away whenever you're ready.
All right, you said we're switching, right?
Yeah, just the opposite order of yesterday.
Okay. All right. So I'll begin. ASA and I negate result. The U.S. federal government should enact the Medicare for All Act of 2019. Our sole contention is quality of care. In the status quo, there are many insurance companies that compete with each other, so the reimbursement prices the insurance companies pay the hospitals stay relatively high. However, with Medicare for All, the U.S. government becomes the only provider of insurance. This causes hospitals to not be able to negotiate the prices, so they would be most likely similar to the prices we've seen with other single-payer countries. And currently, hospitals and doctors are not getting fully reimbursed when they treat their patients with Medicare. As the point in 2019 says that Medicare reimbursements was $53.9 billion short of actual hospital costs, and that 2/3 of hospitals received Medicare reimbursements that were less than the actual cost. This happening on a nationwide scale would be even more disastrous, and the quality of care diminishes in 2 ways. Subpoint A, Medicare for All stifles innovation. American innovation is destroyed by Medicare for All, as America is currently responsible for a plurality of world medical innovation. Turner in 2012 writes that the US remains the world leader in medical innovation, having produced more than half of the world's new medicines over the last decade. Turner concludes stating that the US remains the undisputed leader in biopharmaceutical research. Our regulations and taxes put the biomedical sector at risk. Once these jobs are lost, it will be extraordinarily difficult to get them back. And Wayne in 2015 writes that the development of a new pharmaceutical can cost between $1.3 billion and $5.9 billion. This money would not exist under Medicare for All, as hospitals get significantly less reimbursements. And passing the Medicare for All bill would destroy medical innovation, as Richardson in 2020 says that more than 50 US economists and professors have signed an open letter warning that Medicare for All plans lead to shortages throughout the health sector that would restrict access to care, undermine quality, lead to innovation stifling price controls, and adversely impact the economy. The world stage cannot afford an American switch to a single-payer system. The impact to this is emerging diseases. We need as much innovation as we can to better prepare ourselves for the future, because according to the World Health Organization in 1996, there have been at least 30 new diseases that have emerged in the last 20 years, many of which there is no cure or vaccine. Subpoint B, doctor shortages. These happen for 2 reasons, the first being lesser pay. Doctors and physicians are already starting to burn out, as Pipes in 2019 observes a recent survey which found that more than 40% of physicians say they are burned out, and 1/3 said insufficient pay was a major stressor. And the second reason shortages occur is because of the poor quality of working hours. Pipes observed in the same survey that 1/3 of doctors also said that long hours were a major stressor. We have also seen this in other countries, as they further that in the UK, about 60% of the National Health Service staff work unpaid overtime each week. And according to Boyle in 2020, a report from the Association of American Medical Colleges projects that the US will face a shortage of between 54,000 and 139,000 physicians by 2033. This will only be worse with Medicare for All, as now doctors will face even slimmer paychecks and longer working hours, since all of their patients have Medicare. The impact to this is increased mortality. We have already seen the effects of this in other countries, because according to Campbell from The Guardian in 2019, that 9 out of 10 hospital bosses in England fear understaffing across the service has become so severe that patients' health could be damaged. It is crucial that the physician to patient ratio doesn't drop anymore, since in 2005, Starfield, along with 3 other colleagues, saw that the greater supply of primary care physicians, the lower the total and heart disease mortality rates were. This is important due to the fact that the CDC in 2020 quantifies that about 647,000 Americans die from heart disease each year. It is crucial that the physician ratio doesn't drop anymore, since Starfield furthers that an increase of 1 primary care physician per 10,000 people was associated with a 6% decrease in all-cause mortality. Thus, ASA and I negate.
Okay. So, is everybody ready? I'm just going to start. Okay. Olivia and I affirm resolve the United States federal government should enact the Medicare for All of 2019. Contention 1, increased access to birth control. In 2010, the Affordable Care Act, ACA, was passed. This represented great strides for women's reproductive health, as tailored from the Center of American Progress in 2017 finds as of 2014, oral contraceptives accounted for 3.6% of out-of-pocket spending for women with private insurance. Before the ACA's contraceptive mandate, oral contraceptives accounted for nearly 21% of out-of-pocket spending. Unfortunately, women employed within the United States are at risk of losing their access to birth control. NPR 20 cites the recent Trump administration rollback on ACA, making it legal for employers to deny women access to birth control through their health insurance plan. Problematically, Adam Cizik 20 finds that this could result in up to 126,000 women losing contraceptive coverage, costing an individual $584 annually. This reversal could be devastating. Adam Cizik continues that before the ACA, 1 in 3 Hispanics and 4 in 10 Black women said they could not afford to pay more than $10 for contraceptives. However, MFA provides a solution, as Title II of the bill guarantees comprehensive reproductive care and the payment of pharmaceutical drugs. By affirming we can effectively ensure women have access to birth control by making healthcare cheaper, since MFA eliminates out-of-pocket costs, women will never have to pay for birth control. The impact is the empowerment of women. Before access to birth control, women dropout rates were at an all-time high and wages were at an all-time low. However, HALCO 7 finds that unrestricted access to birth control reduced college dropout rates by 35%. Planned Parenthood in 2015 furthers that birth control increased the proportion of women in skilled careers like medicine, dentistry, and law from 1970 to 1990 by 30%. Planned Parenthood furthers that 1/3 of the wage gains women have made since the 1960s are as a result of oral contraceptives. Unfortunately, the negation would reaffirm the idea that the strides women have made throughout the years due to birth control mean absolutely nothing. Contention 2, mental health. According to the CDC, 18 suicide rates increased 33% from 1999 through 2017. The Office on Women's Health in 2018 finds that more than 1 in 5 women in the U.S. experience a mental health condition in the past year. As of right now, many uninsured Americans aren't able to access mental health treatment. McCurgy 13 reported that 45.6 million American adults are suffering from a mental illness, but only 38.2% were able to receive help. 15% of them stated insurance coverage was their main obstacle, while 50% reported the cost alone to be a problem. That's incredibly important, as the National Council in 2019 found that every 6 in 10 Americans were seeking mental health services. Despite the demand for treatment being so high for Americans, cost barriers prevent millions from accessing care. However, under Section 201 of the Medicare for All bill, it lists both mental health treatment services and inpatient care as being part of the benefits. The impact is reduced suicide rates. MFA allows those with disorders to access help they need through direct treatments. The Mental Illness Policy Organization of 2019 reported about 50% of individuals with severe psychiatric disorders as receiving no medication. Furthermore, the Institute of Medicine in 2010 writes that there is a direct correlation between suicide rates and whether someone is medicated or not. In particular, when examining Hungary, the NCBI noted that when the antidepressant prescription rate increased by 62%, the overall suicide rate dropped by 20%. Because the status quo targets the most vulnerable, we urge an affirmative ballot.
All right, are you ready for cross?
Yep. So I believe you have first question.
Yeah.
Okay.
All right, so I'll start it now. So how many women each year don't go to college or drop out of college that would have if they had birth control?
Well, we don't have a specific stat for that, but our Planned Parenthood card clearly says that when oral contraceptives were more accessible, that there was a 35% dropout. Actually, I have a question on the doctor shortages. Is wage the only factor that it really boils down to when it comes to deciding on this major?
No, as I said, in case longer working hours for doctors is another. Okay, so now I'm going to ask a question. So back on to the college dropout rates. So how high or how low is just college dropout rates in general? I would have to say they were pretty low, right?
Well, it really depends on the major, but we don't have a specific statistic on that. Not that we really need them, because our Planned Parenthood card clearly states that it's just a 35%. Moving on to your argument on innovation, how much exactly is spent on research?
By who? like, well, and as I said, in case, like the cost of like a new drug can it be anywhere between like 1.5 billion and 5.9 billion dollars.
Okay,
Okay.
and out of like everything that they spend on, how much is like what percentage
Wait, could you
of
repeat
research
that?
and development?
I don't know the percent, but it's still billions of dollars.
Okay.
All right.
You
So yeah. So onto your mental health. So would it matter if these people are able to get care if like hospitals shut down? Like say there
that
is
would
care
matter.
up, but then they aren't able to go to the hospitals to get it, right? Isn't it important that they get like referred to get the medication first before they can actually
Yeah, that's
get
what
the,
would happen.
okay. Do you have
Well,
a
you have
question?
to take into account that Medicare for all, like the plan slowly eases in over like a 2-period span. So it wouldn't be like, oh, all of a sudden, all of this is happening. It's a slow, gradual thing. Anyways, so I wanted to ask, would the increase in patients like for hospitals, would this even out over time?
Yeah, because now like all of the people on Medicare, they can go to the
No,
hospitals
they
and they're
don't need.
covered. Okay. Okay, so
Okay.
yeah, back on to like the college dropout rates, because you keep on saying like the 35%, but it could just be a drop from like 10% to around like 7%. Like, how do we know it's that significant? Okay, because like unless you can tell me like how high the college dropout rates are.
Yeah. Well, we don't have a specific stat for that, but like I said, it's 35% dropout.
Okay.
And that's fine.
All right, Asa, you taking prep?
I am not. I am ready. Okay. Just let me get my timer out. All right, I'll just be going down their case. Okay, is everyone ready? Okay, then I will begin. So starting on their first point of birth control, one, you can delink it. Biden is currently projected to win the 2020 election. He is currently leading Trump in the polls by double digits in several key swing states, such as Florida. Byte Coffer in 2020 writes, in poll after poll, Biden now holds double-digit leads nationally in head-to-head contest against Trump, along with robust leads in an ever-expanding map of swing states. These red states are now becoming a mix of red and blue. This impending Trump loss has gone as far as spurring Trump to make an attempt to delay the election, a power the president does not have. Biden has been a vocal advocate for a woman's right to birth control. The status quo currently would solve the problem that the affirmative is so advocately against. Biden pledges to repeal of the Trump administration's Title 10 gag rule, protecting birth control for 4 million people. So what this tells you is that you solve for the problem. In a second turn, the developers of modern day birth control developed the oral contraceptive through private funding. Only in a free and open market would innovation ever be able to occur like this. By voting for the pro side, you are shutting the door on potential future research and development for not only reproductive medicine, but life-preserving medicine. What this tells you is that this life-saving research for millions of women was developed by private industries. Now, to respond to their point of mental health, there are also two responses. First, the pro side would stifle United States mental health innovation. The United States is currently the world leader in mental health research and is able to maintain their status through the free private nature. Zhang in 2017 explains the US is the world leader in psychological research, producing 32.68% of all scientific articles related to mental health illness. The next in line was the UK with a mere 8%. Ketamine, a drug at the forefront of antidepressant treatment, was developed by Pfizer, a private pharmaceutical American company. What this tells you is that life-saving research is caused by innovation. Even if you don't buy that argument, you can still turn it. Tyler explains, nationalized UK mental health appears to be a beacon of what US mental health care can become. But under the current system, the United healthcare of hundreds of thousands is being swept under the rug. Blanchard in 2019 explains almost 300,000 patients who qualified for talking therapy last year spent at least a month on the hidden waiting list, an investigation revealed. The patients all had their first appointment. though, could be counted as having started treatment. But this was usually an assessment, and the real therapy started in the second. But these people had to wait over a month. What this tells you is that while it looks like there are higher treatment rates in other countries such as the UK, these people have to wait for such long times that they're not able to seek life-saving treatment that could prevent suicide. The issue that our opponents so adamantly care about. What this tells you is that you cannot buy either of their arguments. In best case scenario with their contention one, you delink it. In the worst case, you turn it. Same applies to their contention two of mental health.
I'm just going to take running prep really quickly.
Okay, sounds good.
All right. Let me just get set up here. All right, so it's going to go framework, their case, and then our case. Can everyone hear me okay?
Yeah, we can hear you well.
All right, sounds good. Okay. So first of all, what you're going to want to prioritize in today's round is reducing sexism, and it's the most important thing to value. Adam Cizik in 20 finds that 126,000 women are at risk of losing birth control, as it is now legal for employers to deny coverage. By denying women access to birth control, we reverse years of progress. Morse 11 says that without birth control, women are more likely to have lower income and lower levels of education, with 62% of pregnancies being unintended among those earning less than 100% of the federal poverty line. We link in by providing more birth control because of the free access due to MFA, which results in increased education, as seen in our Planned Parenthood 15 card, because the reduction of unintended pregnancies allows women to actually finish college, which results in them getting higher paying jobs, which creates equal opportunities across the board. Now let's move on to their case. So first they talk about hospital reimbursements, but we need to realize that hospital reimbursements would actually be higher under MFA. Public Citizen 20 finds that 83% of rural hospital closures occurred in states that rejected Medicaid expansion. This is because Callback 20 finds that as private premiums increase, more people are left with bills that they can't pay for, and they end up leaving hospitals that are skipping out on payments and ending up having to foot the bill for them. However, Medicare for All actually guarantees reimbursement under this bill, so hospitals are going to earn more. Next, move down to their innovation argument, where they tell you that innovation decreases. First, turn this because Big Pharma won't cut research and development because they don't fund it. Young 19 confirms that 81% of major drug company innovation comes from third parties. Second, finally understand that Grassley 19 finds that 58 million Americans can't afford pharmaceuticals in the first place. Access is a prerequisite to innovation. You can innovate all you want, but you're not going to make any profit if no one can buy the drug in the first place. Grassley continues that women are disproportionately more affected by increasing drug prices in the status quo. When you vote neg, you further entrench us in a world where women are denied basic medical treatment. Now, let's move on to their doctor shortages argument. First, turn this. Lower compensation under MFA isn't necessarily the case. Carell of the PNHP furthers that doctors will no longer lose money on charity cases and patient bankruptcies and administrative burdens because the government will be footing the bill. If doctors are incentivized by pay, they'll be even more likely to continue working. Now, let's move on to their wait times argument, where they tell you that quality of care is going to decrease and wait times are going to increase. This is empirically false. Quinn 15 found in 2014 when Americans were required to have health insurance, wait times went down to 24 minutes from 31 minutes. The warranting is simple. When you have access to regular care, you get less sick and you don't need to crowd doctors' offices. Now let's move on to their response to our case. They have this whole Biden's going to win argument, but first it's an assumption. we don't know that Biden is going to win, but we outweigh on probability because our impacts are happening right now in the status quo. And second, most people don't even participate in polls anyway, so we don't know that the numbers are true. Next, they talk about innovation and that birth control needs innovating and mental health, but like you can link it to our last argument. Innovation is not going to decrease. Plus, birth control doesn't really need innovating in the status quo thing.
Are you ready for cross? Oh, I didn't hear you. I don't hear you.
I forgot to unmute myself. Yes, you can have first question.
Okay, cool. Just let me get my timer out. Okay. So starting now, so you said doctors are being paid more, correct, in countries, or doctors being paid more if you switch to Medicare for all, right?
Yeah.
Could you name a nationalized healthcare system outside the US where doctors are paid more than in the US?
Right. So a lot of these countries that you like keep referencing that have nationalized healthcare systems don't have the same economy as the U.S. So the translation there's not the same. But what you're going to see is that doctors in the status quo, when MFA gets passed, are actually going to be paid more money because now they're avoiding administrative burdens, and also like they don't have to deal with patient bankruptcies or charity cases anymore because the government foots the bill. Can I have a question?
Yes.
All right, so this is going back to your guys' case. You guys link into doctor shortages through longer working hours, but hospitals and doctors' offices aren't required to stay open longer during MFA. So how are they going to be working longer hours?
Because of the fact that like doctor shortages are going to occur, and so because of that, there's going to be more of a doctor burden. There's going to be less doctors having to treat more and more people, and that creates this cycle where because of the fact that longer. Can I finish my answer?
Yeah.
Because of the fact that 30% of doctors said that long hours was a contributing factor to burnout. So if that's the case, more people are going to be in more hospitals. So there's going to be more doctors that are quitting as a result of that. That results in less doctors, and then it's more of a burden on those doctors. So this creates this like cyclical problem that will like keep getting worse whenever you enact Medicare for all. Can I have a question?
Sure.
Okay, with your thing about like a birth control, and you said that like we're making an assumption about Biden winning, right? So aren't you also making an assumption about Trump winning? Like, how can you guarantee that Trump's going to win?
Actually, no, it's not. Our argument's not based on an assumption at all. Like, the Supreme Court already ruled that Trump was doing was constitutional, right? So here's the thing. So either Biden wins and he repeals this, but women are still not going to have access to birth control in the meantime if we don't pass MFA, or Trump wins and women still don't have access to birth control.
Isn't the resolution going to be enacted in 2 years? So aren't women not going to have access to birth control for 2 whole years? So like, how is that going to exist?
That's actually not true. So it's that MFA is going to be transitioned over that 2 years. So it accounts for like when private insurance companies are closing down, right? Like that's what the 2 years accounts for. That people that work in the private industry can actually like find other jobs. It doesn't account for the actual laws that MFA is going to put in place.
Okay, so when can we expect universal coverage for birth control for all women? Is it the second that this bill gets passed? Like, what's going to happen to these to these pharma companies that are providing birth control? Like, what's going to happen to them? They're going to phase out, right? So how can we guarantee universal access to birth control? Okay, so how can we guarantee universal access to birth control the second that this bill gets passed? And if that's the case,
the bill ensures that Medicare
yes,
now
but
has
what
to
is
cover
going to happen
private
to these
insurance.
pharmaceutical
So when the bill
companies?
gets
Are
passed,
they going to
like those laws go into effect?
So they're not allowed to provide birth control the second this bill gets passed. I thought it's a phase out process. I think that's time.
Okay.
I'm just going to take some prep. Okay.
Good.
Okay, so I got 215. Oh, let me put my camera on. I got 215 for the time used. Okay, so I'm just going to address their framework, then go our case, their case, or their case, our case. Okay, and my time begins now. So on their framework, while furthering the rights and freedoms of women is extremely important, lives take precedent in the weighing of the round. The death in sudden extreme circumstances disease can throw people into disproportionately affects the underprivileged. You're going to also extend what ACES said on their case, that Biden is most likely to win because of the current polls. That's really important because even if not everyone votes in the polls, you're still going to realize that a lot of people do. And so that's why you're going to prioritize Biden winning. And then Biden has also been a constant advocate for birth control, and he plans to repeal what Trump had actually implemented. So you're actually going to see more access to birth control for women. Then on top of to their response, and then on top to their mental onto their birth control, you're going to realize that birth control you're going to extend what Asa said, that birth control won't exist without innovation in the first place. That's why it's so key to keep innovation, because all these new and important medicines and technology that come from it. Now you're going to realize that now onto our case. You're going to remember that first of all, you're going to extend the warrant on doctor shortages, because as Asa said, the doctors are still going to be increasingly burdened because there's going to be a current shortage. That just increases the patients the other doctors gets, and this just creates a cycle where they have more patients in longer working hours, and that will lead to future shortages. That's very important because that's where you actually see our impact manifesting, where we say that the CDC, or that increase in primary physicians actually decreases mortality. That's where you're going to outweigh us on scope and magnitude, because when primary care physicians decrease, heart disease mortality also decreases. And this is extremely beneficial, as the CDC wrote that 650,000 Americans die from heart disease each year. Thank you.
Okay, I'm gonna take running prep.
Okay.
So start now. Okay, that was 42 seconds. I'm gonna write that down just in case. Okay, so I'm gonna turn on my camera. Okay, quick little roadmap. I'm gonna go our case, their case, and then wait. And I will begin now. Reducing sexism is the most important impact on today's round. The status quo is allowing employers to deny women access to birth control, the very thing that progressed the advancement of women in society. Extend Morse 11 that says with restricted access to birth control, women are more likely to fall into poverty and have lower levels of education. This reaffirms the idea that women are lesser than men and opens the door for abuse and microaggressions. We link in by providing more birth control because of free access under MFA, which results in an increase in education, as seen in the Planned Parenthood card, as the rate of unexpected pregnancies decreases, allowing women to finish schooling, which results in women being in higher paying jobs and equal treatment. Next, we're going to discuss what they said in summary. They say that Biden will win, but note that this is all assumption based on poll numbers that not everyone participates in, and they're forgetting that the Electoral College's vote can swing an election. They also say that antidepressants and birth control will stop will stop. But remember, as Olivia says, Big Pharma isn't the one innovating in the first place. Rather, Jung 19 says that 81% of innovation comes from third parties. Second, remember when Olivia mentions Grassley 19 card, which is that 50 million people in the US can't afford pharmaceuticals right now. And this disproportionately affects women. The prerequisite to innovation is access. You need to sell drugs to innovate. They extend doctor burnout shortages, but extend their term that goes unresponded on doctor shortages. Carol of PNHP finds that doctors won't have any administrative burdens or patients who can't pay, which will increase patient turnout, thus increasing the amount of money they make. We outweigh on magnitude because the severity of sexism is unimaginably worse than any other impact when we allow employers and the government to deny women access to birth control. We'll begin to see more women with lower wages, less education, and less opportunity, which results in the dehumanization of women as the negation willingly subjects them to completely avoidable circumstances. Thus, we urge an affirmative ballot. Thank you.
I'll take running prep. Did you hear me?
Yeah, go ahead.
Oh, okay, cool. All right, starting now. All right, let me get my timer out. The order will be addressing framework, addressing their contention one of birth control, and then extending some offense on our case. Everyone ready? Yeah. Okay. Starting now. So, Judge, our framework went cold, conceded. The only argument they gave is that sexism is bad. We can all agree that sexism is bad. However, our framework goes much further than just sexism alone. What we talk about is while furthering the rights and freedoms of women is extremely important, lives must take precedent in the weighing of the round. They try to use this argument about severity, but that is entirely not true because lives are a lot worse than sexism, although sexism is really bad. Because you have to, one, ensure doctor and hospital availability, and two, ensure medical innovation, you have to vote in favor of the negative side, even under this like the sexism framework. Okay, moving on to their case, or moving on to their case. First, the only offense that they have left remaining standing is their contention one of birth control. And we give this this Biden card saying that Biden is proposed to win the election. Their only response is this is just an assumption, but so is the assumption that Trump is going to win. But when you defer to an objective means of measurement, which is the polls, then you can see that Trump is far more likely to lose than Biden is to lose. And Biden has been a vocal advocate of expanding access to birth control. So the status quo would already solve the only offense that they have left remaining in the round. Even if you don't buy that argument, you can look to the turn that we gave, saying that innovation can only exist in America. Whenever you eliminate these the way that these companies can make money, then what you do is you eliminate almost all forms of innovation. The only response that was given was this 81% card, but that is entirely skewed because the card says that 81% of NIH funding results in something being researched. That's all that it says. Now moving on to our offense, you could extend our subpoint B of doctor shortages. The only thing that they talk about is that government will foot the bill, but there's entirely no proof in that. And that is evident in the fact that every single country that has passed Medicare for all pays less than the cost, and doctors are paid a lot less. Jake read to you in case that this makes doctors more likely to drop out, which results in doctor shortages. This went completely conceded. For those reasons, I urge you to negate.
All right, so I'm just going to take running prep. Okay. So I'm just gonna go our case, their case, and then weighing. Can everyone hear me?
Yep, loud and clear.
Sounds good. All right. So first of all, extend our framework. Reducing sexism is the most important impact in today's round. Morse 11 finds that without unrestricted access to birth control, women are more likely to live in poverty and receive less education than men. This reaffirms the idea that women are lesser than men and opens the door for abuses and microaggressions nationally. We link in by providing more access to birth control. That is going to happen under MFA. It's not a question of if it's going to happen. It's a question of when it's going to happen. Because of the free access through MFA, this results in increased education, as seen in our Planned Parenthood 15 card, through the reduction of unintended pregnancies. Ultimately, women will be able to access higher paying jobs when they have access to unrestricted birth control. Unfortunately, in the status quo, women's access to birth control is being significantly restricted. We must act now before the severe effects of sexism take place. This won't affect just the 126,000 women we read in case. It'll affect all women nationally as sexism becomes more and more normalized in today's society. Now, Asa comes up here and he tries to tell you that we didn't respond to his framework, but don't let them link into their impact of saving lives, because we've proved this entire round multiple times that doctor shortages don't happen, and they don't respond to this in summary, meaning that they agree. They only respond to this in final focus to the card that we read. They just repeat their card. Doctors are incentivized by pay, which they'll be receiving more of, and if our opponents had read the Medicare for All bill, they would have seen that the Medicare for All bill actually outlines this perfectly. Doctors are going to be receiving more pay, and you can look back to the hospital reimbursement card we read. So ultimately, we outweigh on magnitude because the severity of sexism is worse and inevitable if we continue in the status quo. The negation is willingly subjecting women to impoverished conditions, microaggressions, and less education, which are extremely avoidable circumstances if we pass MFA and provide birth control unrestricted to everyone. Thank you.
That was all right. That was quite the round. It was as a listener and just an audience member, that was very exciting to listen to. Because all four of you seem to be very enthusiastic about receiving disclosure, I'll disclose now. I voted AF, which is interesting because I voted neg the other day. So there are a lot of specific comments for all of you that I'll email you. But in general, I think that the AF does a lot better today than yesterday on the framework. I thought that was much clearer. Just spending time on it in speeches, that is also important. The stuff about like Trump and Biden, I thought that was a really interesting response, but that is kind of an instance of where it's really easy to get lost in the details of the debate, because by the end of the round, it was just like, is Biden going to win? Is he not? But it wasn't explained how that really applied to the argument in any way. Like Asa, you had great evidence in rebuttal about how like Biden is very pro birth control, but I would have liked to hear more of that in Final Focus. And also from the AF team, I would have also liked to hear about how maybe it doesn't apply. Maybe there are other reasons why. Just one suggestions I would have for your case, I think that a much better link into birth control is just simply the fact that lots of women are uninsured, not the fact that they need to go through their employer to get birth control. Because first of all, like that's only a fraction of the population of women, and also it's like it opens you up to this political question of does Trump's policy stand? Is it going to be supported by the courts? Is he going to lose in the election, etc. In any case, I think that this debate went really well. I was proud of you all. It's recorded, so I'm sure Stan will probably be going over it with you all anyway, and I'll be sending you my comments shortly. So before we say farewell to you all, I just want to wish you all the best of luck in the coming school year. I think that you are all on the path to success, and I look forward to hearing good things about all of you.
I also voted AF, just putting that out there for like the same reasons. Yeah. Just Asa and Jake, I would say just like if you're gonna like offer an alternative framework, like you have to warrant it out. Like I don't think you'd like did enough warranting, but that's the additional.
I'll also second that, and I'll write some things in my comments.
All right, but good job, everyone. I hope you all learned a lot. It was really nice, or it was really enjoyable watching all of those debates. So, good job, everyone.
All right, congrats, everybody. Thank you, and have a good summer. All right, bye, everyone.